Hi, I'm Dr. Kim Carlucci from Montclair, New Jersey. Did you think chiropractic is just for backs? Well, that really is not so. In fact, many people see chiropractors for neuromusculoskeletal problems like nerves, muscle, and structural pain often find an overall improvement in their health that may include fewer and less severe colds, flu, and other respiratory problems. In my office, when you're not feeling well, we encourage the patients to come in for an adjustment, and I'm going to explain why. Well, did you know that there is a link between the alignment of the vertebra and the body's ability to function properly? This includes the immune system. In very simplistic terms, if the vertebrae are misaligned, they will impinge on the ability of the nerves branching out from the spinal column to properly communicate with the brain. If the brain is not receiving or sending correct signals regarding the body's function, it can lead to increased risk of injury or illness due to the stress on the neurological system. In an analysis in the Chiropractic Journal of Australia, the authors compared results from a number of articles that all studied the effect of the chiropractic manipulation on immune response. As a whole, the literature does strongly suggest that chiropractic manipulation had a positive effect on T and B lymphocytes, natural killer cells, plasma beta endorphin, and antibody levels, and phagocytic activity, all of which are known to play roles in the body's immune response function. Although flu and cold symptoms like fever, backache, headache, muscle and joint pain, runny nose, congestion, sore throat, and cough can cause serious problems in the elderly and those who are weak and have immune deficiencies, for most of us the flu is a little more than an annoying illness. Hippocrates, the father of medicine, wrote, "Diseases are crisis of purification, of toxic elimination, and symptoms are the natural defenses of the body. We call symptoms diseases, but in fact, these diseases are the cure of disease." Acute infectious diseases serve a purpose: to burn off and eliminate toxins and other waste products, to cleanse you and rebalance your system. Although cold and flu symptoms are uncomfortable, they may serve a greater purpose. That was revealed by a 1991 study in the Journal of Cancer Research and Clinical Oncology, where researchers discovered that individuals who had febrile infections, childhood diseases like measles, mumps, chickenpox, had less cancer as adults. Similarly, in the Journal of Medical Hypotheses, a study done in 1998 revealed that a history of common colds or influenza was associated with a decreased risk of stomach, colon, rectum, and ovarian cancers. The common cold is associated with a virus that affect the nose, throat, larynx, and sinuses. That means stuffed and running nose, scratchy throat, watery eyes, stuffed sinuses, and congestion, but no fever. Well, did you know that breathing cold viruses does not in itself cause a cold? Experimenters placed cold viruses directly on the mucous lining of their subject's nose. Only 12% of the subjects came down with the colds. In fact, it is that your body is inhabited with all kinds of germs all the time. However, for your germs to overgrow into an infection, you must first be fertile soil. Your resistance to disease must be low. It can be caused by stress, such as structural stress, that the type that chiropractors correct, chemical stress, such as toxins in your body that haven't been properly eliminated, and emotional stress. Usually a combination of two or more can set off an infection because it drops your resistance. There are multiple drugs for colds that are meant to suppress symptoms, such as alkalizers, multiple analgesics, antihistamines, decongestants, which are all developed all for symptomatic relief. By the way, taking antibiotics for a virus does not work. So what is the chiropractic approach to fighting a cold? Chiropractic care can raise your natural resistance to disease by removing serious interference to your optimal body function, which we term subluxation. Natural resistance is the only reason your cold goes away rather than lasting for weeks, months, or an entire lifetime. There are numerous case histories of chronic cold and flu sufferers having less or no colds after chiropractic care. For example, when spinal motion was restricted, people tend to have more infections, bronchitis, and or pneumonia. However, if motion can be maintained or reestablished, patients recovered without complications. In another study, 92% of the patients with chronic obstructive pulmonary disease had improvement in the respiratory symptoms after spinal care. So to finish off this long-winded talk, to prevent colds and flu this winter and to improve your overall resistance, seek out a good natural chiropractor. Reduce your emotional stress, reduce the chemical toxins by reducing chemicals and the garbage food that you're putting into your system. Drink plenty of water and exercise to help your body circulate and eliminate. As always, chiropractic brings out the best in me. Let it bring out the best in you. Yours in health, I'm Dr. Kim Carlucci.